after you've looked at the anatomy video, now we're going to talk about the meniscus. The meniscus are two C-shaped structures inside the knee, one on the medial side, one on the lateral side. They help to decrease the stress on the cartilage. So if you do get a tear in the meniscus, then it decreases that weight-bearing function of the meniscus, so you end up getting more arthritis. So sometimes they need to be treated surgically, sometimes they don't, but if there's a large tear, a root tear or a circumferential tear of the meniscus, or one that pops out of place like a bucket handle tear, you sometimes need to have it fixed. Our goal always is to fix the meniscus because of the weight-bearing function of it. But if we're unable to fix it, we would then remove the bad section. What that does is that prevents the progression of the tear. Because if you start a tear, it's much easier to extend that tear with your daily activities. So we will look at the MRI with you. We'll discuss exactly what we would recommend and do, but you can always try and treat it conservatively. That's always an option. We will, however, let you know if the meniscus tear is so big that you're going to get a significant amount of arthritis in the future. But if you don't want the surgery and the meniscus tear is not that big, we can give you an injection to try and calm it down. Not everyone needs a meniscus surgery, just they have a meniscus tear. There are many people age 70 and above that have meniscus tears that are asymptomatic for them. So we don't usually go in aggressively unless you're very young with very little arthritis, or if it's a root tear, which means you lose all those circumferential fibers that help keep up the femur, because that's going to mean you get significant arthritis within 10 years. So we will discuss that with you in the office, and we'll also talk about it at the surgical center if you have any further questions about meniscus tears. If the meniscus tear is that bad, we sometimes will do meniscus allograft, where we take cadaveric tissue and insert it in that position to play the role of your natural meniscus. But once again, we'll discuss that with you if you come to that.